My name's Veronica Paquette. I'm a physical therapist and owner of Essex Aquatic and Rehab Center, which is an outpatient private practice in Essex Junction, Vermont. The upcoming case study is a gentleman that I have worked with. He is done his therapy at this point. He had a total shoulder replacement back several months ago. And he started in the pool pretty much 1 week following his surgery. He still had steri strips on. You will hear him refer to that. We placed Tegaderm over his steri strips. His incision was well healed, well closed, very fast healer. But he will, as you will see in his program, and he will tell you, his arm, it was a left shoulder, was pretty non-functional prior to his surgery. He was not able to do much of anything with that arm. And at this point, he is now pain-free and says that his arm is working probably better than it was 20 years ago at this point. And he thanks the pool to a lot of his recovery. There were points during his rehab that he actually couldn't stand working on land because of some of the discomfort, and he just was able to use much more range of motion and with less pain in the aquatic medium. So you will see him in the upcoming videos. One thing that we didn't video, actually two things we didn't video, is use of the treadmill. I will use this for any shoulder client to work on just their functional gait, working on frontwards and sideways, backwards walking, using that arm for arm swing and arm push and pull and ab and adduction. Great way to just get them holding that arm not in that whole guarded position. We also did use with him the massage hose just along his scar for scar tissue mobilization, but he also developed a tennis elbow from working on stretching so much at home, and we used the massage hose on that area as well. This was the time when he couldn't tolerate any land activity because it aggravated his elbow. He could do everything in the pool, so that really helped along with his progress as well.
My name is Wally Stein. I'm 66 years old. My shoulder was probably injured in either a motorcycle accident or playing football or ski accidents, and it finally got so sore that I really couldn't do a lot of the activities that I enjoy doing. So I waited until I was old enough that I will probably my joint will outlive me, so I had it replaced in September. Now I'm pretty much, the joint is absolutely pain-free. The only pain I have is when I do silly things with the muscles and tendons that support it. From using the pool standpoint, I think it allowed me to get range of motion and do exercises that improved range of motion that I couldn't do on land in the beginning. We started the pool a week after the surgery with the steri strips covering up the wound, and I was good to go pretty much after that. So it's been like 3.5 months, and I'm back to normal activity defined as what I used to do 20 years ago.